Hello again, this is Dr. Nathan Saydyk from Stone Ridge Dental in Gilbert, Arizona, and this is my Friday video blog. I'm going to talk to you today about cavity prevention and some of the things that we do here at Stone Ridge Dental to help prevent cavities in our patients. There's a statistic that I wanted to quote that talks about toothpaste consumption in the U.S. Yearly, we spend $1.8 billion on toothpaste in the United States. That's a lot of toothpaste. And you can't watch primetime television without seeing one or two or more commercials trying to sell you mouth rinse or a toothbrush or something to improve your oral health care and prevent cavities. So it's obviously very important to us. We spend a lot of money in this country trying to prevent cavities. Dentistry in and of itself, it's not been that good at cavity prevention. Our model's been kind of reactive. The model we talk about in the past for the old style of dentistry is drill, fill, and bill dentistry. We'd wait until you had a cavity, and then we drill it out, put a filling in, send you your bill, and basically send you on your way. The only advice that we had for anybody who struggled with cavities or to prevent cavities was make sure to brush and floss twice daily. Now, brushing and flossing are important, but are they really the best thing you can do to prevent cavities and prevent decay? And oddly enough, the answer is no. The brushing and flossing alone aren't the best things you can do to prevent decay. We see lots of people who brush and floss twice daily, sometimes even more, and they still have problems with decay. And we see other people that, probably could improve their brushing and flossing, and they don't have a decay problem. The example I use to show you brushing and flossing is your credit score. So if you wanted to raise your credit score up and you decided that you were going to pay your bills on time, that wouldn't really have too much of an effect on your credit score, right? On raising it. There's lots of other strategies you can do to bring your credit score up, but paying your bills on time is probably the least effective in raising the credit score. However, if you don't pay your bills on time, that is a very sure way to destroy your credit score very quickly. And all the fancy strategies that you had to raise your credit score wouldn't matter if you weren't at least paying your bills on time. So paying your bills on time is the bare minimum. It is the baseline for having a good credit score. The same thing with brushing and flossing your teeth. If you're having a decay problem, sometimes the least effective thing you're going to do is brush and floss more. And as far as prevention goes, that also is the least effective way. However, if you aren't brushing and flossing, I can assure you everything is going to get worse exponentially, right? It is the baseline for a healthy mouth is to brush and floss at least twice daily. But what are the real big things that are going to have an impact over whether or not you get decay? The answer is what you eat and drink on a daily basis and how you eat and drink it, as well as a couple other things. In dentistry, in modern dentistry, we have a system called CAMBRA, and that's Caries Management by Risk Assessment. The kits and the system we use at Stone Ridge Dental is called CareFree. Feel free to look them up online. They have a great website with a lot of information. Basically, through risk assessment, through bacterial testing and visual examination, we find out what your risk classification is. With that risk classification, that tells us how likely you are to develop a new cavity within the next year. Coupled with each risk category is a cleaning system for at home, plus there's a book, and we do nutritional and behavioral counseling for you to try to figure out what are the risk factors that are putting you at more risk for decay, and we try to mitigate and eliminate those so we can get you a healthy, clean mouth. The example I use to explain this to people is heart disease in medicine. If we treated heart disease like we do cavities and decay, then we'd wait for you to have your first heart attack. We'd never talk to you. Once you had your heart attack, we'd give you a bypass, and then we'd send you out of the hospital and say, hey, we'll see you at your next heart attack. But that's not what we do. In medicine, we assess the risk factors that put you at risk for heart disease and a heart attack, and we work preventatively to minimize those risk factors so we can reduce the effects of your heart disease or not have it in the first place and hopefully not have heart attacks. And that's the same thing that we do in dentistry with the CAMBRA and with the CareFree program. if you have any questions about any of this, it gets pretty complex when we start talking about decay and pH and everything else. So I try to do that on a one-to-one basis for people. I'm going to have a couple other videos that explain each one piece at a time. But if you have any questions about your particular case, we'd love to talk to you down here at Stonebridge Dental. Don't forget to like us on Facebook and share our Facebook page with your friends. Almost all our patients come from word of mouth. It's the best way for us to get new patients. We love our patients and we want more like them. So share this video and share our Facebook page with your friends, please. And again, if you have any questions about dentistry or anything you'd like me to talk about, drop us a line at info@dentist-gilbert.com. Have a great weekend.